Hello everyone, welcome to OET Answers. In this video, I'm going to discuss about a particular information. Definitely, it is really useful for you and vital information too, right? So, among many of you have no idea about the 30 seconds, how we are using 30 seconds in the part A listening. Okay, so I'm going to explain this information about the listening only. So in the listening part A, okay, for part A, extract 1 and extract 2, you can see two different extracts for 24 questions. So how can you successfully attempt the 24 questions with the right answers? Okay, I'm going to teach you in this video. So let's start now. Usually, in the part A, you will get 24 questions, right? So 24 questions which divided into two categories, so which comes under extract 1 and extract 2. So extract 1 you will get 1 to 12 questions, and extract 2 13 to 24 questions will be there. Okay, so overall 12 plus 12 is equal to 24. Okay, so how can we get better scores, or how can we get the full scores in the part A? I'm going to teach you some tricks, but try to apply the same tricks on your another listening, right? Okay, so starting initially it will be difficult to adapt with the timing and marking questions, everything following on the same time. It's really tough, but if you practice makes perfect, right? Yes, if you're practicing, definitely it will be on your path. All right, for your understanding, left side you can see the question page, right? So extract 1 and the conversation, questions, subtitles, everything you can see. For your understanding, I have made it. So first you have to understand in the extract what they have given. Okay, so extract, you can see 5 bulletin points, right? So extract 1, first bulletin point indicates two consultation extract. So overall they are explaining both extracts. Okay, in both extracts you can see two different consultation, like a physiotherapist talking to the patient, or in your another text you can see a rheumatologist talking to the patient. Okay, so for example you can see here, you hear a physiotherapist talking to a new patient, right? Yes, coming to the second bulletin point, medical professional and a patient. Okay, the conversation between medical professional and a patient. Third one, piece of conversation. So entire audio, in each extract you will get different audio, right? So each audio has piece of information related to disease condition or related to any of the consultation. Coming to the fourth bulletin point, which indicates duration is around 5 minutes. Okay, each 12 questions, okay, each extracts you have to complete within 5 minutes. Okay, it may be last for 5 minutes. Coming to the last bulletin point, the audio can be heard once. Okay, it will not be repeated. Okay, this is the extract bulletin points. I will explain about these in detail the following pages. So we got the idea about extract. Now moving to the questions. Okay, so 12 questions in each extracts already I have explained. Notes completion task. Notes completion means nothing but, so you can see the blank spaces, right? So you have to complete the blank space by writing the right answers from the audio. Then third bulletin point, questions are synonyms to the audio. Definitely, okay, question might be synonyms to the audio. They won't give you anything directly on the audio or the question booklet, right? So your audio and the question, how you can see on the page, which will be completely different. Okay, so instead of back injury, they can say any other synonyms form, right? Okay, so this is the exact flow or pathway. How can you start exact the part A listening, right? So you can see the first general instructions. Okay, how will be the general instructions usually? Like this is test is an occupational English test, listening test, and this test has 3 parts. Each part you will hear a number of different extract, and start of each extract you will hear this sound beep, right? Yes, followed by you will have time to read each questions before you hear each extract, and you will hear each extract once only. Complete your answers as you listen. At the end of test, you will have 2 minutes to check your answers. This is your entire instructions, and this is about overall listening instruction. And coming to the depth instruction, they will mention us in this part of test you will hear two different extracts. Okay, in each extract a health professional talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now look at the notes for extract 1. This is the entire general instructions of the part A listening. Okay, so followed by that, after general instructions, immediately your extract 1 introduction will be played. Okay, so you will get the extract 1 introduction. You will turn over the page, immediately you can see the extract 1. So after seeing the first extract 1, what you can see, you have to utilize the 30 seconds pause. Okay, this is what we are going to discuss in the entire video. 30 seconds. How can you utilize 30 seconds? Okay, how can you utilize? I will tell you later. And followed by the 30 seconds, your extract 1 audio will be played. Okay, first general instruction followed by that extract 1 page you will take, and 30 seconds utilization time, and third one is extract 1 audio will be played and you will mark answers, and followed by that immediately extract 2 will be started after few seconds. Okay, so extract 2 like a same page, question page will be opened, and followed by that you have to hear 30 seconds. You have to utilize the 30 seconds time for finding answers, anticipate answers, everything. The method exactly I will teach you, and extract 2 audio will be played. Okay, this is the exact pathway. All right, now we can come to the point. So left side you can see the questions. First, look at the pink code. Read instructions. Okay, read instruction means what you can see. So extract 1, questions 1 to 12. You hear. Okay, so just follow me. You hear a physiotherapist talking to a patient called Ray Sands. Okay, so here you can find out the healthcare professional, physiotherapist and Ray Sands. Okay, patient and physiotherapist conversation. So as I mentioned in the first page, extract, based on the extract I have given, right? So what conversation, what piece of information they have stated, you can see here. And for questions 1 to 12, complete the notes with the word or short phrase. This is the instruction. Okay, and you now have 30 seconds. When your audio saying your 30 seconds have started now, means immediately you have to start referring. Okay, read headings. Okay, how can you exactly utilize? Now you got the idea, right? Physiotherapist and Ray Sands means patient. Okay, physiotherapist means you can predict almost information. Physiotherapist, in which condition the physiotherapist will be involved? Is there any mobility problems or related exercise, and followed by follow-up things and all carried out by the physiotherapist, right? So the condition which is related to injury or any other mobility problems related condition only will come here. Okay, so you can almost anticipate the piece of conversation. Okay, now we can see the patient name Ray Sands. Already they have mentioned in the question. Now 18 months ago, so your second instruction is read headings. Okay, but following read headings. So 18 months ago, don't only read the headings initially. Okay, so same time simultaneously you have to read the headings as well as marking the question keywords as well as anticipate the answers, everything. The last 3 points you should have done simultaneously, same time. Okay, so 18 months ago, back injury sustained lifting. Okay, so where you can mark keyword here, 18 months ago, you got the idea. So already they have mentioned bolded letters, so no need to mark a keyword, but just remember in your mind 18 months ago, back injury, underline the back injury, sustained lifting. In the bracket what they have mentioned, lifting dash they have mentioned. So lifting, by understanding the question, lifting means what you can understand. Lifting means lifting any of object, right? Any of the object only we can lift, like suitcase, carry bag, or any other things, right? So back injury, you can predict almost answers. Any of the object would come as answer. And back injury sustained, so after lifting the heavy object only, the back injury sustained. Okay, so you can connect like that. Okay, we have very short time. If your practice beginning very clearly on the time of examination, it will be easy for you. Okay, now you clear the first question. Moving to the second one, 1 year ago. So you have to be aware about the synonym pattern, right? Already I told you, instead of 18 months ago, they can say almost half months ago, like anything, or else if you see the second question, 1 year ago. 1 year ago means they can say as 12 months ago. 12 months indicates 1 year, right? So 12 months ago, sciatica developed. Don't think I have to read only the blank region. Wherever I have to apply answers, there only I will read. Don't have this conception. Okay, so because you have to understand where actually point started, where they are speaking, and in which area they are coming. If you want to get all information from the audio means, you have to read the all information on the question booklet. 1 year ago sciatica developed. 6 months ago, instead of 6 months they can say half year ago. Okay, half year ago, clear of symptoms means there is no problem. Last month, so instead of last month, whether they can mention the name of month, or else last month or previous month they can say, or a month ago. Okay, a month ago, recurrence of symptoms. So recurrence, instead of recurrence they can say another synonyms pattern. Okay, this is about the supportive information. Now coming to the next one, patient description of symptoms. So by understanding the title, what you can understand, description means explanation, right? Explanation of symptoms. So means the patient describing or explaining his experience of symptoms. So how he experienced with the symptoms. Okay, so second question, pain located in. Pain located, where you can identify or anticipate answer. Pain located in, underline located in. Located in means in particular body part, right? So particular body part the patient has pain. So where the exact location, pain located in the location, you can anticipate answer as either right leg or left leg, right? Okay, then moving to the question number 3, pain described as. Okay, pain described as what? Pain describe how the characteristic of pain, whether it is intense or two pounding pain, like. Okay, so loss of mobility, instead of loss of mobility, impaired mobility they can say. Problems in sleep, difficulty in sleeping they can say. Okay, almost I hope you got the idea. Just pause here. Coming to our tricks, so as I told, first we have done read instructions, second one read headings. Almost we read all the headings. Third task is read the notes and mark the keywords, read the notes and mark keywords. So as I mentioned, so as how I already told you to follow me, right? So wherever I marked, you have to do the same thing. Okay, so marking means nothing but if you're marking any word, that must be useful for you. Means by marking that, you can get the audio or information of, you can get the information from the audio. Okay, so if you're marking and other those things means that will not support you, right? So very valuable words. Okay, if I mark this only, I can get the answers means you can choose that as some keywords, right? Then finally anticipate already we have done. So for question number 1, I told you, right, lifting and lifting. So after lifting only the problem occurred. So lifting means object, a particular object only can be lifted, right? So an object would come here, so like a suitcase, carry bag, any of the heavy weights, like. Moving to the second, so pain located in particular body part, right leg, left leg. Okay, so you can anticipate it, expect the answer, right? So pain described in, so described means characteristic, how the pain was, intense or pounding, okay, or stabbing pain. Then coming to the question number 4, mentions inability to dash as most frustrating aspect. Mentions inability means patient unable to do something. Unable to do something means what you can understand from all that? Unable to what? Unable to sleep, or unable to be comfortable, or unable to something disturbing in his daily life. Okay, that we have to expect as answer, as, and that is the most frustrating aspect. Okay, so where I marked question keywords, inability to, underline inability to and frustrating aspect, the two things you can mark as a question keyword. Coming to the question number 5, dash sensation, and in the bracket they have mentioned as curves. Curves means the particular area, right? So back of the leg. So dash sensation, you can understand sensation, definitely that abnormal feeling will be there, right? So dash sensation in the courses. So general numbers in the area, occupation. So occupation in the sense, so you can understand, so what type of job the patient dealing with. So question number 6, dash involve travel, some manual work. So okay, the job involves travel and some manual work. So either you can understand as a journalist or any other things like a events organizer, tour guide, any of them, right? So likewise you have to follow the 4 instructions. I hope you got my point. So I will explain one by one. Read the instructions. Okay. By reading the instruction, what are the things you can consider? Who is talking to the patient? Either specialist, GP, or general practitioner, or the nurse. Okay. So the conversation between with the specialist or another person. So okay, first we have to determine that, and based on the determination, already I told you, physiotherapist means we can understand this is the mobility related problem would come, right? So you can predict the piece of conversation and type of conversation. So based on this only, based on the first bulletin point, you can find out the type of conversation. First consultation, follow-up, review, these are all the things comes under the area, the subtitles. Okay, types of conversations, you have to understand what type of conversation they are doing. Either consultation means first time the patient coming and meet the doctor and getting the advice. So follow up means after discharge, after taking treatment, after discharge, after a few many days, they are coming. And review, you can understand that it's like a follow up. Okay, your second trick is read headings. Okay, already I shown you. Read headings means you can read all the headings, like 18 months ago, 1 year ago, 6 months ago, last month, patient description of symptoms, occupation, everything. Okay, by reading, all the titles, you can get the information. Okay, so in the particular title, subtitle, under that you can see this information which is related to the title. Okay, you can understand that. So understand the headings. First bulletin point is mandatory, then commonly you can see. Okay, so you can see the headings like a history, assessment, diagnosis, and treatment, further actions. Okay, sometimes you can see as a whatever surgery, advice, follow up, like, right? So history, if you see the history, present, past, medical, social, family, background, for reason for coming, all the histories will be included. Okay, reason for why the patient coming to the hospital today, presenting complaints. Okay, like, so coming to the assessment, test, description, interpretation. Assessment means what? So how we are assessing the patient, based on the assessment what we found. Okay, so all the test, blood test, USG, and x-ray, all the things will come. So and their description, and what is the result. Interpretation means the result only, right? Coming to the diagnosis, possibilities, either suspected diagnosis or definitive means accurate diagnosis, whether you can find out. So all the things comes under the each headings. Okay, by understanding the each headings you can get the idea. Treatment and future actions. So treatment, under the treatment means you can consider, okay, medication name would come here, and the treatment, further follow-up, advice, everything would come in this area. Okay, so treatment, by seeing the title only you can determine what kind of action they are speaking there, right? So our third trick is read the notes and mark keywords. Okay, so read the notes and mark keywords. How can you read the notes? You have to read the all questions and mark the keywords. While reading the question, you have to understand the title, the subtitle, and also you have to read the keywords. So how can you mark the keywords? Like 18 months ago, so this is we can see already in bolded letter, so no need to consider. If there is no bolded letter, you have to mark. Back injury, lifting. Okay, 2 keywords you can take. If the question is too long, 2 to 3 keywords you can take. If question is short, 1 to 2 keywords more than enough, right? So back injury, sustaining lifting, a dash, and sciatica developed. Coming to the question about pain located in dash. So pain located, underline the located. Pain described as, so described, pain described, pain, about the pain only they are speaking, right? So pain described, how they are describing. Loss of mobility. Coming to the question number 4, mentions inability to, patient not able to perform something, so which is related to the activities. Okay, like anticipation. Also I am explaining about the marking keywords, reading the notes, as well as anticipating the answers too, right? So identify, first bulletin point, identify important words having possibilities to hear, spot directly on the audio. Okay, so wherever you are marking the keywords or the words, that would help you to spot the information directly on the audio. Okay, so in the audio, okay, this information only they have given as a question here, like you can determine. Then second bulletin point indicates, underline those words, especially before and after the dashes. Okay, before and after, always be careful with the area before and after what the dash in. You can see the dash here, right? So look at the question number 4, mentions inability to. So before the dash I have marked inability to, after dash as most frustrating aspect. Okay, so the particular activity only not able to perform, as well as that is the most frustrating aspect. Okay, so two things you have to consider. So when the blank space is coming, so before and after you should be looked at. Okay, so we should be very careful on that area, because previous things should not be repeated and the following thing also should not be repeated. Okay, so synonym patterns sometimes they will mention. So in order to prevent the repetition, we have to careful with this area. The last trick is anticipate answers. Okay, you can predict or expect or guess the type of information. You will need to listen for the names, date, medical condition, treatment. Okay, so you can listen and same time you can predict answer for apply in this area. Okay, so sustaining. First question, back injury, sustained lifting, a dash. So lifting, an object would come. I told you, right? An object name. So in the audio, what object they are mentioning in this area? 18 months ago, what object they have mentioned? So if heavy suitcase means you can write as heavy suitcase. So coming to the question number 5. Dash sensation curves. Okay, sensation means abnormal feeling in the particular body part. So they have mentioned curves also. So particular body area also they have mentioned. So what kind of sensation they have? Okay, so that also you can write like a tingling sensation, burning sensation, any of them, right? So you can anticipate likewise. So once again, predict the information. You will need to listen for names, dates, medical condition and the treatments. Okay, you can guess all the information. Okay, so that's all about the description of each steps. And I would like to remind you, so you have to follow the 3 steps you can see, right? So read headings, read the notes and marking keywords, anticipate answers. Okay, the 3 things you have to done simultaneously. Okay, so there is no specific time or there is no specific step for each. So the 3 things only we have to do while the 30 seconds. First, read the question. So while reading the question itself, you have to mark the question keywords, and marking the question keywords itself, you have to anticipate the answers. Okay, all the 3 things you have to do at same time. Okay, there are no separate time or there are no separate step. Okay, the 3 things should be done simultaneously. Don't forget this. All right, so that's all about the 30 seconds. I damn sure and I assure you, if you follow this method, definitely 100% you can valuably utilize the part A, extract 1 and extract 2. If you use this information valuably, you can spend the time and you can take the correct answers. Okay, just be aware about the synonyms pattern also, so that will be really helpful for you. Okay, so just try, because many of them thinking listening is the easiest part, but reading and listening both are easy if you learned strategies. But if you fail to learn, or if you just have to have 50% of knowledge, means it's really difficult. So please, whenever I'm posting videos, just give a look on that and try to learn and try to get in your practice. Okay, so just practice regularly. If you're practicing regularly, you will get the correct intervention, right? So that's all about the 30 seconds. So hereafter we can see in another audio or another video sessions. Thank you. So if you have any queries, just try to contact OET Answers. The contact details have been posted. So if you want to enroll the course, all the details you can contact on the contact number, so that you will get beneficial on that. Thank you.